Hello, my name is Ruth from Olaya, Rojas, and today I'm going to talk about a private report Mesenchymal Hamartoma of the liver and Dicer1 Syndrome. Definitions. Mesenchymal Hamartoma of the liver is a benign tumor of infancy characterized by an admixture of epithelial structures in a loose connective tissue stroma with fluid accumulation suggestive of lymphangiomatosis channels.
A hamartoma is a benign, focal malformation that resembles a neoplasm in the tissue of its origin. This is not a malignant tumor, and it grows at the same rate as the surrounding tissues. It is composed of tissue elements normally found at that site, but which are growing in a disorganized mass. They occur in many different parts of the body and are most often asymptomatic and undetected unless seen on an image taken for another reason. Incidentaloma. Choristomas, forms of heterotopia, are closely related benign tumors, found in abnormal locations. The two can be differentiated as follows. A hamartoma is an excess of normal tissue in a normal situation, for example a birthmark on the skin, while a choristoma is an excess of tissue in an abnormal situation, for example pancreatic tissue in the duodenum. Hamartomas result from an abnormal formation of normal tissue, although the underlying reasons for the abnormality are not fully understood. They grow along with, and at the same rate as, the organ from whose tissue they are made, and, unlike cancerous tumors, only rarely invade or compress surrounding structures significantly. Hamartomas, while generally benign, can cause problems due to their location. For example, when located on the skin, especially on the face or neck, they can be very disfiguring. Cases have been reported of hamartomas the size of a small orange. They may obstruct practically any organ in the body, such as the eye, the colon, etc. They are particularly likely to cause major health issues when located in the hypothalamus, spleen, kidneys or lips. The most common hamartomas occur in the lungs. About 5–8% of all solitary lung nodules, about 75% of all benign lung tumors, are hamartomas. They almost always arise from connective tissue and are generally formed of cartilage, fat, and connective tissue cells, although they may include many other types of cells. The great majority of them form in the connective tissue on the outside of the lungs, although about 10% form deep in the linings of the bronchi. They can be worrisome, especially if situated deep in the lung, as it is sometimes difficult to make the important distinction between a hamartoma and a lung malignancy.
Dicer1 Syndrome is an inherited disorder that increases the risk of a variety of cancerous and non-cancerous tumors, most commonly certain types of tumors that occur in the lungs, kidneys, ovaries, and thyroid, a butterfly-shaped gland in the lower neck. This affects individuals can develop one or more types of tumors, and members of the same family can have different types. However, the risk of tumor formation in individuals with Dicer1 syndrome is only moderately increased compared with tumor risk in the general population. Most individuals with genetic change associated with this condition never develop tumors.
Tumors are caused by mutations which are alterations in the DNA sequence of a cell. These modifications alter normal cellular programs. How do mutations occur? Our DNA is continuously damaged by chemical agents such as smoke, or by physical agents such as UV rays and X-rays, or by biological agents like viruses. Our DNA can also be damaged by molecules generated by cell metabolism, such as reactive oxygen species, or during DNA replication. In the first case, we talk about exogenous mutations, since they are caused by external agents. In the second one, we talk about endogenous mutations, since internal agents cause them. There is also another possibility. Mutations can be inherited from our parents if they were present in their germline cells, the oocyte and the sperm. In the first case, we talk about acquired or somatic mutations. In the second, we talk about inherited mutations. What can we expect in the case of inherited mutations? Everyone has two copies of the same gene. One has been inherited from the mother and the other from the father. If one of the parents carries a mutation in a gene X, then all of the cells will have that mutation. The other copy of the gene is normal. Therefore, cells are viable and function normally. If by chance, in one cell, an event produces a mutation in the second copy of that gene, and if that particular gene is involved in crucial processes such as DNA repair, then DNA repair mechanisms will alter their function. The cell can initiate alternative programs that will cause it to become a cancer cell. Therefore, everybody that inherits this mutation will have an increased risk of developing cancer with respect to the rest of the population, since he or she already has the first mutation. That's why we call this type of cancers hereditary tumors, unlike sporadic tumors that are triggered by accidental mutations during one's lifetime. Hereditary tumors represent between 5 and 10% of all cancers diagnosed in the population. Some examples of hereditary tumors are the non-polyposis colon cancer, or the familial adenomatous polyposis, or the hereditary breast and ovarian syndrome. Tumors are caused by the accumulation of mutations in the DNA. Tumors can be sporadic when DNA mutations arise by chance, or they can be hereditary if the patient already carries a genetic predisposition.
Applications in medicines. Identification of Dicer1 germline mutations in patients and their families is important in assessing future risks of neoplasia and allows the opportunity for predictive testing for families to identify individuals at risk for Dicer1 related tumors. Similarly, family stories that contribute to the presence of less distinctive DICER1 related features such as early onset MNG or wild tumors may warrant genetic referral if they occur in families with DICER1 related tumors in close relatives. Several cases of MNG in a family may be enough to consider making a referral to genetic service. Due to the unique and rare nature of many of the known DICER1 related tumors, the presence of any of the distinctive tumor types alone, PPVC, NSLCT, CIRMS, PB, and CBME would warrant consideration.
Hey there, Soda Peeps. How's it going? Henry here. Let's go over a liver mass on a toddler. So here we have a large right lobe liver mass. Now the most common liver masses in the pediatric population would be a hepatoblastoma, which this was thought to be. Here we have a cine loop going superior and inferior through the mass. And here's the CT. See, the mass is very large. It's palpable. And right there, extending from the right lobe, you can see the lesion. It's heterogeneous. So like I said, this was thought to be a hepatoblastoma. It was actually a mesenchymal hamartoma, which is good news because the mesenchymal hamartoma is benign and a hepatoblastoma is a malignant tumor. Again, in pediatrics, hepatoblastoma is the most common form of liver cancer. Overall, as childhood cancers go, it is not common and it is seen usually before 3 years of age. Mesenchymal hamartomas are also uncommon. And like I said, they are benign lesions, and they are rarely seen in adulthood. And that's mesenchymal hamartoma.
Pros and cons. First, pros, identifying a germline Dicer1 mutations allows individuals to receive personalized medical follow-up and to consider evaluation for Dicer1 related tumors. Tumor surveillance allows the identification of a tumor at an early stage, so it can be removed and treated with a fewest possible consequence. Screening newborns who carry the mutations for an early cystic type 1 (PPV) may allow surgical removal and prevent the disease from progressing to type 2 or 3 PPV, which carries much poor prognosis. An effect relative of a person with a germline DICER1 mutation can be evaluated for the familial DICER1 mutation to confirm or rule or risk status. Because the penetrance of the Dicer1 syndrome with respect to tumors appears to be quite low, and cascade genetic evaluation of relatives can identify the familial Dicer1 mutation in unaffected relatives who may be at risk for tumors or may benefit from it. Knowledge of early intervention, such as genetic testing and evaluation of tumors in infants. Cons, we have other symptoms may occur, such as anorexia and vomiting. Treatment of mesenchymal hamartoma is almost always surgical by conventional liver resection or not anatomical excision with a small margin of normal tissue. Some surgeons suggest that incomplete resection is safe, although it should be avoided due to the possibility of symptomatic recurrence even 13 years later, with the potential risk of malignancy. Issue applied in Ecuador. Incidence in Ecuador is considered by isolated, being liver tumors are relatively rare in childhood, just at 2%, and of these, the hamartoma mesenchymal constitutes only the 8%. Um, predominates in male sex, often manifests clinical before 3 years of age with a maximum between 18 and 28 months. Most of them are located in the right lobe, the 75%, and the result of liver function are normal in most of cases. Conclusion. In conclusion, the hamartoma mesenchyma in the liver represents a lesion with an anomalous solitary vascular supply that may evolve into a specific pattern with stromal cyst as a result of early ischemic change. Thank you so much.